Mr. Vogt, we are living in a moment in American history where at a time when 60% of our people are living paycheck to paycheck, we have more income and wealth inequality than we've ever had. Multi-billionaires own more wealth than the bottom half of American society. People are struggling to put food on the table. Very rich are getting much richer. We have heard from our Republican colleagues in the House that they think it is a good idea to go forward to provide massive tax breaks to the billionaire class and at the same time help pay for that by cutting back on Medicaid. And I know that you are more than aware that Medicaid not only provides health care to tens of millions of lower income people, but 2 out of 3 people in nursing homes in America, elderly people, are on Medicaid, paid for by Medicaid. You are going to be an advisor to the president if you are approved. Will you tell the president that it is immoral, that it is wrong to cut Medicaid, cut health care for low-income Americans, for children, and for the elderly, and give tax breaks to the very richest people in our society? Is that something we can count on you to do?
Senator, one of the problems, and I appreciate the questions, one of the problems that we have in the Medicaid problem is the extent to which, instead of being a program for the poor, it's alone, and the extent to which it's meant for nursing homes and things of that nature. We have able-bodied working adults on the program that are benefiting from a higher match rate than the populations that it was originally designed for. And as a result of that expanded match, you also have states kind of chasing that match in other ways that have made it so that they're not looking at improper payments.
All right. You're going into I don't have a lot of time. You're going into another area, and that is a healthcare system in general. As you well know, unfortunately, the United States of America is the only major country on earth not to guarantee health care to all people as a human right. And the result of that, despite Medicaid, and we can argue about this or that aspect of Medicaid, despite that, 85 million Americans are uninsured or underinsured. And importantly, and your colleague, Mr. Musk, made this point, we are spending far more on health care than any other country per person. I wonder, as an advisor to the president, will you try to determine how it is that countries around the world are able to provide care to all of their people, and in some cases spend 50% per capita of what we're spending? Do you think the function of the American healthcare system should be to make huge profits for the insurance companies and the drug companies, or do you think maybe we should have a system that guarantees healthcare to all people as a human right? Do you believe that healthcare is a human right?
Senator, I believe that it's very, very important that we put the healthcare dollars that the taxpayers are covering for the healthcare system, which you just mentioned is substantial, and to make sure we have the best outcomes in those programs. I want the people who benefit from Medicaid to have a great Medicaid program. And I look at a situation, a tragedy we had where DeMonte Driver, a 12-year-old, dies of a toothache because the infection was never
You're right.
Never
the healthcare.
found.
Look, I don't want to argue. The healthcare system, in my view, is broken. It's dysfunctional. But my question to you, it's a simple one, as an advisor to the president. Do you think we should join every other major country on earth and say, you know what? Whether you're poor, you're rich, you're young, you're old, healthcare is a human right. We are the richest country in the history of the world. Do you think we should do what every other major country on earth does?
Senator, I think it's important to provide legitimate, evidence-based outcomes for people within the healthcare system, and to make sure that we tailor all of the dollars that are spent towards
But that, you didn't answer my question.
That they have good
Mr.
healthcare.
Vogt, my question, fine. Question is a simple question. In America, should we do what every other major country does and say, I don't care if you're poor, you're rich, you're old, you're young, healthcare is a human right? Yes, no?
Senator, I think the president has not made he ran on providing good healthcare outcomes. That's my view.
You're an advisor to the president. You're going to be a key advisor if you are approved. Do you think that healthcare is a human right that every American should be entitled to?
I believe the role of the Office of Management Budget Director is to take what the president has run on, the things that the president has as a policy agenda, and to turn that into policy, to implement that. And so to the extent that he has run on having lower prescription drugs, that's a priority of the administration.
Good, are you? Well, thank you. All right. The president in the past, I don't know about recently, has indicated that he would maybe do what President Biden did, stand up to big pharma. We are paying now, in some cases, 10 times more, as you know, for the same exact drug that other countries are paying. Are you going to advise the president to take on big pharma and do what he promised to do? And that is have Americans not pay a nickel more than other countries for prescription drugs. Will you advise him to do that?
Senator, the president has not made an announcement since he's been in office, but he certainly ran on this issue. There was a speech with regard to making sure that we were getting the same types of arrangements that the other countries were, given the amount that we're investing in it. But he also, Senator, wants to do it in a careful way so that we are not ruining the phenomena and the industry that allows us to have life-saving
I got it. I do understand that, and I don't disagree with that.
Drugs.
We want innovation. But will you maintain what we fought very hard to do what every other country does, have Medicare negotiate prescription drug prices with the industry?
No, Senator, I'm not here to get in front of the president on any of his policies, other than to say that this has been a priority for him, and I think your question reflects that it's been a priority of his.
I've overextended my time. Thank you, Mr. Chairman.